Hello everyone, so this is your fourth lecture of General Anatomy where we are going to study about the blood supply of long bone. So before we start the blood supply of long bone, I would like to clear about some concepts of long bones. That is, in young long bone, what happens is we have epiphysis, diaphysis and then epiphysis. We have epiphysis, then epiphysis plate and then metaphysis. Now in young long bone, we have epiphyseal plate, that is a cartilage. But as soon as you reach puberty and after puberty, this epiphyseal plate gets degenerated and the only thing left is a epiphyseal line which is not really visible. So in long bone, if not young long bone, if in long bone you see there will be only epiphysis, metaphysis, diaphysis and then metaphysis, epiphysis. There will be no epiphyseal plate in long bone after puberty. So epiphyseal plate is seen only in young long bone. So here we will study about the blood supply of long bone. So in long bone we have studied that we have epiphysis, metaphysis, epiphysis and metaphysis. If this was a young long bone, then we would have present epiphyseal plate here. But since it is not there, we are studying only long bone. We have epiphysis, metaphysis, and here also metaphysis and epiphysis and the diaphysis region. So in blood supply, here we have supply of epiphyseal artery, on both sides epiphyseal artery. Here also we will have supply of epiphyseal artery, and in metaphysis we will have supply of metaphyseal artery on both sides. Here also we will have supply of metaphyseal artery. Epiphyseal artery, metaphyseal artery, epiphyseal artery, metaphyseal artery. So now here there is a concept of nutrient foramen. What happens is we have a nutrient foramen, a canal kind of structure from where nutrient artery will enter in your medullary cavity region. This is nutrient artery. Now this nutrient artery will enter the medullary cavity and forms an ascending branch and a descending branch. Descending branch and an ascending branch. So nutrient artery will supply your medullary cavity region and your inner 2/3 of cortex region. Here, this is cortex region. We had studied in previous lecture that this is a cortex region, also forms compact bone. So we had inner 2/3 region. Here we have, it is divided into your inner 2/3 region and outer 1/3 region. So nutrient artery will supply medullary cavity and your inner 2/3 region. The outer 1/3 region, this region, the outside of your cortex region, will be supplied by periosteal artery. Periosteal artery. Periosteal artery. Let us revise the arterial supply of long bone. In epiphysis, we will have supply of epiphyseal artery. In metaphysis, it will be supply of metaphyseal artery. Same epiphyseal artery, metaphyseal artery. Now there is a nutrient foramen from which nutrient artery arrives. Nutrient artery then divides into ascending branch and descending branch. And this nutrient artery will supply your medullary cavity region and inner 2/3 of your cortex. The outer 1/3 of your cortex will be supplied by the periosteal artery. This periosteal artery is absent in sesamoid bone. So make sure whenever it is asked, if it is a sesamoid bone, there will be no periosteal artery present. It is an exception, and in rest every bone we will have supply of periosteal artery also there. Nutrient artery will form the ascending branch. Now here the ascending branch forms a hook-like structure, hairpin-like structure, and if there is a short long bone, in short long bone, here instead of this hairpin-like structure, a plexus kind of structure is formed. So here we have learned the two difference, that is everything will be same, but in long bone the ascending branch will form a hairpin like structure, but in a short long bone, we have studied the types of long bone. So we had a short long bone type, that is miniature long bone or short long bone. So in short long bone we will have plexus kind of formation that is formed by the ascending branch. We studied the blood supply of long bone, and now there is a concept called growing end of long bone. What would be the growing end of a long bone? That is the part from where the growth will take place once the child is born and during the phase of life. So, growing end of long bone will always be opposite to the direction of nutrient foramen. We had studied nutrient foramen from which the nutrient artery arrives, and now ascending branch, then descending branch. So, growing end will always be opposite to direction of nutrient foramen. Now, how will we know about the direction of nutrient foramen? The direction of nutrient foramen has got a mnemonic which says, I go to elbow and flee from knee. That is, it will move, the nutrient foramen will have direction towards your elbow. It is here. From this region, it would be towards here. Consider this as your direction of nutrient foramen. So, it will move from here, and from this your forearm, it will move here. That is, I go to the elbow, towards the elbow. Whereas flee from knee, that is, if you consider this as my knee region, here as my knee region, you will see flee from knee. That is away from knee. That is from here, opposite, and from here. I go to elbow and I flee from knee. This diagram is given in B.D. Chaurasia book, so I had copied from that. So if anyone asks what will be the growing end of long bone, so here we have examples of long bone such as humerus. If we take the example of humerus, we have humerus here. Here it is present, humerus is here. So the direction of nutrient foramen is towards the elbow. So this. So what will be the direction of growing end? It will be opposite. That is towards the head of humerus. That is upper end of humerus. Now let us consider another, that is radius ulna, that is present over here. So in radius and ulna, what will be the direction of growing end? Nutrient foramen moves towards this direction. So growing end of long bone will be towards this direction. That is towards the lower end. Towards the lower end. Now let us take another long bone, that is your femur, the longest bone. So in femur, it will be towards the hip bone. What is the direction of nutrient foramen? Towards the hip bone. So it would be away from the hip bone. That is towards your knee. You can write towards the knee. Growing end of long bone will be towards the knee or towards your knee joint, whatever, towards the knee. And if you take tibia and fibula, tibia and fibula has direction towards their ankle joint. So it will be, so the growing end of long bone will be towards the knee. Now, we had learned this concept of growing end of long bone, but here we have an exception, that is in fibula. In fibula, there is only exception is it will be not towards the knee, but it would be the lower end of your fibula. bone. So here we have exception fibula, where the direction of growing end of long bone will be towards there, towards fibula's lower. So here we had studied the humerus, radius ulna, femur, tibia and fibula. The fibula is the exception. Towards that is, it would be in the direction of nutrient foramen, and rest all the direction of growing end of long bone will be towards the direction of nutrient foramen. So we had studied the blood supply of long bone, where we had studied the direction of epiphyseal artery, metaphyseal artery, periosteal artery, that is in the outer 1/3 of the cortex. The nutrient foramen will lead to nutrient artery, which will again descend into ascending branch and descending branch. But this nutrient artery will supply to your medullary cavity and your inner 2/3 of the cortex region. So we had the arterial supply done. Now what we had learned, the concept of growing end of long bone. We can describe it through the opposite direction of nutrient foramen. We had learned the direction of nutrient foramen through this line, and now we can understand the direction of growing end of long bone. That is, in which direction the bone will grow after the person has taken birth. So here we complete our lecture of blood supply of long bone. Thank you so much.